is Lisa Croft, and this is my Global Health Teaching Board presentation. The purpose of this teaching board is to educate on different countries and their demographic profiles, and also address some of the issues that affect the healthcare in these particular countries. The criteria for selecting the countries were that all these countries begin with a C, which is the first letter of my last name. And secondly, I wanted to pick a diverse group of countries. So in addition to that, I tried to pick countries that were spread across the globe. And luckily I was able to pick all that were actually on different continents. So as to get a more diverse picture of the topics that I was looking at. So the first country I chose was Cambodia. This country is located in Southeast Asia, and just to give you a little idea of the size, Cambodia is about the size of Oklahoma. The second country I chose is the Central African Republic, which is located in Central Africa, and it is also about the size of Texas, a little bit smaller than Texas. So that kind of gives you a little perspective of how big these countries are. The third one is Chile, and it is located in South America, and it's about the size of, twice the size of Montana. The fourth country is Cuba. Cuba is in Central America, and it is approximately the size of Pennsylvania. The Czech Republic. The Czech Republic is located in Central Europe, and it is about the size of South Carolina. So those are the countries I looked at and compared data on. And I'd like to go through each country individually and talk about that one country as a whole, rather than hitting one topic on all of them. I think it makes it a little more clear on the picture of that country. So Cambodia being my first country, I'd like to talk about this comparison of my data. I picked just some basic statistical type data to list here. I think it kind of makes a little better comparison when you can see it in relationship to all the other countries. One is the population, and Cambodia's population is 15 million approximately. Their urban population takes up about 22% of their total population. The life expectancy for a Cambodian person is 64 years old, and the birth rate is 23.8%, and that's per 1,000 population, and the death rate is 7.68 per 1,000 population. In the bio of the country, I listed some information that specifically tells what their gross domestic product was, which is kind of how much that country is worth for that year. And then also I listed the percentage of that amount that is spent on healthcare in that country, so that the Cambodian health expenditure amount was 7.5%. Well, when I take what that country made last year and what it was worth last year and figure 7.5% of that amount, I come up with how much that country actually spent on their health care, which was $3.5 billion. And two other areas I looked at was the number of the population living below the poverty line, which is 17.7% in that country, and also the population that has access to clean water in rural areas, which is 69.1%, and 30.5% live with access to adequate sanitation. Cambodia has an economy. Their economy reflects how well they're doing. They have what is called a constitutional monarchy, and what that means is there is two elected officials. One is head of state and one is head of government, and they actually share power. One is responsible for a certain amount of the government, and the other manages the other part of government. So Cambodia is presenting a strong economy. They've really grown over the last decade, but they're still considered the poorest country in Asia. Their political issues have brought them through a long history of power struggles and fighting for government control. And healthcare infrastructure was virtually non-existent until 1993, when their government did become stable and they began to build a system of healthcare for their people. They're finding that most of their advances are more driven toward the urban areas than the rural areas, and the rural people tend to truly struggle with access to even minimal health care. But they are trying, and they are working toward an end product of providing health care for their people. The last area on Cambodia I would like to touch is how their healthcare is paid. And how they do that is, it's so new, but there is what they call public health care, which is a cheaper version of the private health care. But the public health care is what most of the citizens of Cambodia can afford. It's a little poor quality, and there is limited access. If someone is truly seeking a specialist or a high quality, a high level of quality care, they will have to look toward the private sector, just because they're just not advanced enough yet to handle that. 75% of that country's gross domestic product came from out-of-pocket expenditures and payments from the actual people themselves, and not government money. The next country I'd like to discuss is the Central African Republic. Their population is about 5 million. 40% of their population live in urban areas. Their life expectancy is only 52 years old. Their birth rate is 35 per thousand population, and their death rate is 13.8 per thousand population. The amount of money that their country spent on healthcare last year was just a staggering $112 million. That's just, compared to the rest of the other countries, it's just hardly nothing. The amount of their population that lives below the poverty line is 62%. Access to clean water and sanitation in rural areas, only 54% of the people in rural areas have clean water, and only 7% have access to formal sanitation. Some of the other issues, like the economy, the government is a democratic government. Most of their economic money, most of their money comes from agriculture, from forestry, from mining, gold and diamonds. In the past, diamonds was a huge part of their income. Foreign merchants really exploited the country, their resources, their people, and made a lot of money on the people of Africa, and bought these diamonds. And the government was very corrupt and very out of control and just very volatile, and the people of that country actually never saw any of that wealth that came from all that hard work. Then also some political issues. for Africa is that due to just civil unrest, just armed militia and radicals, international assistance cannot help them with humanitarian programs because of all this fighting. They're confronted by armed people. Their warehouses are looted, their supplies are stolen, they're sometimes even threatened and harmed. There's just a total air of insecurity in that country, and it's starting to affect how much international help they are receiving. Also, some of the environmental factors of Africa are mostly disease type factors, like from the dirty water or from mosquitoes like malaria, things like all the diarrheal diseases that the people are dying from there. Also, I want to touch on with Africa is some of their healthcare system, which is so informal and almost non-existent. It's estimated that half of the medical facilities that actually exist in the country already, half of those are not even functional. They don't even have staff, or they're not even open. What does exist is some government clinics and hospitals. Government clinics and hospitals cost money, and the people of Africa have no money. So you can't be treated there without being able to pay for it. International relief organizations do provide clinics and food and medicines, and those are of course free, but once again, those are very limited. So a lot of people never get health care. The third country is Chile. Chile has about 17 million people. 89.5% of the people of Chile live in urban areas. Their life expectancy is 79 years old. Their birth rate is 13.8 per 1,000 population and 6 per death rate per 1,000 population. Their healthcare expenditure was $31 billion, and their number of people living below the poverty line is 14.4%. 93 and 90 are the percentages of their rural population that have access to clean water and formalized sanitation. Chile's economy is they have a democratic rule. They have a market-oriented economy. They have high levels of foreign trade, and they have trade contract agreements with approximately 60 countries. So they're doing very well in their economy. Some of their political issues are there needs to be a few changes in their healthcare access. They say that the healthcare itself is actually one of the main problems in getting people access to care. The hours that clinics are available is very inflexible. They have a very high staff turnover, and the services are often very scattered, and to a lot of people is a very far distance to actually receive health care. And also transportation is very expensive in order to be able to travel to these clinics, and that makes it very difficult for some people to acquire health care. Some of the environmental factors that Chile faces is also water pollution as far as industrial, and also raw sewer. They also have air pollution from industry and also vehicle emissions due to their high population in urban areas. Of course, that is increased in those areas. The fourth country is Cuba. Cuba is the only country that I've looked at that is a communist state. Cuba has done very well considering their situation. Cuba had a downturn. They were very prosperous for a number of years, and then when the Soviet Union stopped providing them with aid, which came to a number of approximately $6 billion a year in government aid, that really was devastating to Cuba when that money stopped. Cuba struggles with economy issues of allowing their people to become more open as far as starting their own businesses and that kind of thing, and opening their borders to trade and providing friendships and relationships with other governments, but yet maintaining that political control. So that's some of their economy issues. Some of their environmental factors are also air and water pollution. They put very little money toward being green and trying to help their environment. Their environmental situation is below par, which is most every country I've looked at. How Cuba, on one hand, has an amazing healthcare system. They have actually achieved the Health for All status deemed by the World Health Organization. They provide free healthcare to all their citizens. Their vaccination rate is one of the highest rates in the world. They actually score their patients on a health rating system between 1 and 4, and based on their particular risks, and they communicate these findings with districts for tracking, and they actually can identify where there's problems and what they can do to prevent or solve these healthcare issues. Health education is mandatory in public schools in the curriculum, and also birth control is free in Cuba. So when you look at their population, and you can see, like, when it comes down to the birth rate, some of these, like Africa, is 35.08 per 1,000 population, and Cuba's birth rate is 9.9. So that kind of shows where that comes into play, that extra care. Cuba spent $10.15 billion on their health care, and that was in 2013. They also use their healthcare system as a form of income for their country. They have such a surplus of doctors and medical professionals that they actually allow their physicians to work in other countries for a fee. So it's like governments renting physicians when they have none of their own to provide health care. So it's providing definitely a need that's out there. Some of the other things, the percentage of the population that lives in the urban areas in Cuba are 77. The population that lives below the poverty line is 15%. The life expectancy in Cuba is 78 years old. Let's see, access to clean water and sanitation in rural areas is both about 98%. So not great, but better than a lot of countries. The Czech Republic is the last country I'd like to talk to you about. Their population is about 10 million. Their percent that live in urban areas are 73%. Their life expectancy is age 78. They have a birth rate of 9.6 per 1,000 population and a death rate of 10.3 per 1,000 population. The amount of money they spent on healthcare in 2013 was $22.5 billion. The number of people they have that live below the poverty line is 8.6, which is the lowest of all the countries that I've talked about. And access to clean water and sanitation, they have the highest numbers, coming in at 100% and 99.2% for those numbers, which is awesome. Some of their environmental factors as well is the water and air pollution. Some of their economy issues are the Czech Republic is a democratic rule. They are a stable and prosperous market economy. They do trade with other countries. They do have private sector and competition. Some of their challenges they find is management of their aging population and how they plan to sustain a pension plan and a health care plan in the future. That's something they're really having to look at. Also, some of their political issues are there have been recent major changes in their healthcare system. They're really trying to do healthcare reform and improve some of their situation. They have started doing risk adjustment to redistribute the contributions that each person pays in for their health care. They have implemented copays. They've set maximum prices that pharmacy can charge for medications. And also they are starting to provide support for training of doctors and nurses in their country. How health care is paid, the people of the Czech Republic have a health care insurance system. They also have a state and territorial budget for insurance, and then they have a private expenditure. All health care is free to citizens. You contribute a percent of your income, your wage, through an insurance fund, and then health care is provided for you. Some employers even pay that percentage as a benefit in some job positions. That is covering just about everything that I have prepared to talk about. It was a lot, and I would have liked to spend more time on it. I learned a lot from this. It makes you realize how fortunate we are. One more thing I'd like to do before I stop the video is I would like to just close up some of the information on the board so you can actually see it instead of just hearing me yammer. But I'd like to do that now before I end the video. That is the conclusion of my teaching presentation. Thank you very much for your time.